All right, welcome back, everybody, to the brain injury discussion. This is your host, Jay. Today, this is a little bit of a request made by another case manager, the other one here in the Northern Neck. And sleep apnea does not really get talked about a lot in the brain injury world. However, I'm going to make the argument that maybe we should. But like always, I would encourage you to review the sources. They will be in the description below. Also, feel free to leave a comment if there's something that you've learned, or maybe something new that has been brought to light, or maybe you have a question or a topic to suggest. We'd love to hear those. We always appreciate feedback, and especially that. Feel free to give this a thumbs up as well as subscribe to the channel. We do appreciate it when people subscribe. That way you can find out when our weekly videos come out, and that way you can stay informed. So, with that being said, let's get started. So first, what is sleep apnea? Well, it is obstructive sleep apnea. We're talking about apnea, which is, you ever heard of apneic episodes? It's when there's a stop in breathing. So that's apnea. That's apneic. That's the medical terminology, and this happens when you are asleep, and because it is obstructive. And what happens is that you get these repeated episodes of apnea when you are sleeping. So the airway is being obstructed by the tongue. All right. And this results in an oxygen loss, even though for a brief period of time, for multiple brief periods of time, really. And some of the risk factors that might cause someone to get sleep apnea is usually the person is overweight. However, skinny people do get this too, but usually they're overweight. Usually they're males. However, females can certainly get sleep apnea as well. And a lot of the times they're either middle, elderly, or in their advanced age. As you age, you tend to lose some of the muscle tone in your body, and that includes the tongue and the muscles in your neck. But a big one is supine sleeping, which is sleeping on your back. You might have heard prone, but this is the opposite of prone. This is on your back, sleeping on your back. And what we see in this graphic here is we see a comparison on the left side of that graphic. We see a normal, healthy airway that's sleeping, that's breathing properly. And what we see is the air is going through the mouth and the nose, it's going down into the pharynx and down into the lungs. But what we see with the right side of that graphic is sleep apnea, where everything remains the same except the tongue, which is this right here, falls back and occludes this passageway for the air. And that's not a good thing because all of a sudden, what you'll see with sleep apnea is they will jolt awake, and that's because they're going into hypoxia. That's the body's natural response. And so when the tongue falls back on this supine sleeper, we'll see that that's a blocked airway. And this could also be part and parcel with the uvula as well. So keep that in mind for later on in this PowerPoint. But that is what sleep apnea is in a nutshell. And you might be wondering, well, Jay, why are we talking about this? Well, let's see how the brain is affected by sleep apnea. First, with enough of the sleep apnea, we see that in some studies, there will be something called axonal damage. Now, the axon is what connects the neuron to the synapse. See our DAI video about that. Um, but we'll see some axonal damage. We'll also see an altered or possibly disrupted rest and recovery pattern. So your brain isn't getting the same amount of oxygen, thus, it is not necessarily resting enough nor getting into those proper rest cycles. In some severe cases, we will see cerebral damage. Okay, that cerebral damage can be very vast and big. So keep that in mind that yes, hypoxia causes cellular death, and it also can cause cerebral damage. Speaking of hypoxia, that's one of the effects of sleep apnea, and that's bad for the brain. We're also talking about oxidative stress, inflammation, and ischemia. When we were talking about strokes, we talk about ischemic strokes being a very common form of stroke. Well, ischemia, which lack of blood flow, in this case, it's ischemia by way of hypoxia. But it also puts you at a higher risk for brain injury. And you might be asking, well, Jay, how does sleep apnea put you at a higher risk for brain injury? Well, let's talk about it. Sleep apnea and brain injury risk? Well, you're actually higher chance to get a traumatic brain injury when you have sleep apnea, but you actually are a much higher risk of getting a traumatic brain injury when you have sleep apnea and you're on certain medications. And this article down here notes about benzodiazepines, which is the medication that they were studying in this one. But it's really interesting because if you are on medications that relax the muscles, that means that the tongue and the uvula and the muscles in your neck don't have the same tone to prevent the tongue from falling back and working with gravity, really, to fall back in your throat and occlude your airway. Also, we find that sleep apnea tends to have a lower life expectancy. Although sleep apnea is very treatable, we will get into that. But sleep apnea is also a risk factor when we talk about other kinds of brain injuries. And so, if you have sleep apnea, you're more likely to have a stroke. You're more likely to have diabetes. You're more likely to have heart disease. You're in a state of hypoperfusion. So, hypoperfusion, which is not enough oxygen, is being exchanged with carbon dioxide, and that leads to cellular death. It is also a risk factor in acute coronary syndrome, which, if you survive that, you're very fortunate, but you're also uh, probably having a brain injury from the loss of, from basically the stopped blood flow to the brain. It also is connected to a lot of other brain injury and cognitive disorders. And you might be thinking, well, Jay, how does this all work? Well, let's get into that because sleep apnea affects your cognitive function. It negatively impacts your verbal memory. So if I were to give you three words and say them aloud, someone with sleep apnea statistically will not be able to remember them as well as someone who does not have sleep apnea. We'll also see less effective memory recall. And so if I were to ask you those three words, try to remember them, or maybe I'm giving you three objects or point to this sign. So we'll see that statistically, your memory isn't as good when you have sleep apnea. You'll also see some other symptoms. You'll see some daytime fatigue and some slowness. And again, that kind of ties in with why this is an increased risk for brain injury, especially if you work around heavy equipment. Maybe you work on trains, maybe you work on trucks, maybe you work on aircraft. You want to be at 100% brain function when you are operating those machinery. Um, and especially around dangerous environments, especially construction sites. Um, those can be dangerous in the first place, but you want to be sharp. You want to be on top of that. You want to be aware of your surroundings. So daytime sleepiness and fatigue is really a negative thing, especially in those professions. We'll also see hippocampus oxidative stress. The hippocampus is a part of the limbic system, and I would refer you to that video. But if you were to, as an example, have hippocampus stress or damage to the hippocampus or parts of the limbic system caused by hypoxic episodes, your emotions, your mood might not be the same or normal to you at that time. But the longer it's left untreated, the worsening of those conditions. Usually, someone who has sleep apnea but goes untreated will have worse heart conditions, worse diabetes, and more at risk for stroke. And it leads to system consequences within the body. And you might be asking, well, Jay, this is a lot to take in. I said, yes, because oxygen impacts all the cells in your body, not just the ones in your brain. But let's continue on. And so, what we see with those who have the consequences of sleep apnea is we'll see that there are structural changes into the central nervous system, which includes the brain and the spinal cord. We'll also see neuropsychological findings in a lot of cases. Mood changes, again, we talked about the damage or the stress to parts of the limbic system, specifically the hypothalamus. But we'll also see, because of that, increased rates of depression and anxiety. With the hypoxia, we're talking a lot of cellular death and sometimes, in some cases, neuronal shrinkage. And we don't want neurons to shrink. We want neurons to be robust and healthy. And so the inflammation of the brain cells in the hippocampus can be very detrimental to the person. Again, daytime sleepiness, but it's non-restorative sleep. You're not getting the rest out of that sleep. It's important to get not just enough sleep, but also enough quality sleep time where you go into the rapid eye movement cycle and out of it into the non-rapid eye movement cycle where you're truly resting. And so we have here on this graphic here a wonderful image of an MRI. And what we see is a comparison between, on the left, someone with sleep apnea. And that does not look like a healthy comparison when you control it to the control brain, which is on the right side of that graphic, which looks like a very healthy and vibrant brain. There is a difference there, and it's kind of obvious if you think about it. And what we see is that yes, there are changes into the CNS, the central nervous system, which would lead to a lot of the rest of this. And there's probably some cellular death and shrinkage on the left side of this image here. And so that's why it's really important. Now, again, finding the imaging might not always be available except in like really extreme cases. But this is what's happening to your brain when you do not treat sleep apnea. And so, how does one go about treating, mitigating the sleep apnea if you already have it, or preventing sleep apnea? Well, one of the most important things that you can do to prevent sleep apnea is lose weight. And it decreases the severity of sleep apnea if you already have it. So again, that's a big thing that most people can have physical control over is your weight and your body size. And when you lose that weight, you're putting less stress on the muscles in your neck, your tongue, and everything else. And you're actually able to, sometimes we'll see a positive effect from that. And also, if you don't have sleep apnea, losing weight will reduce your likelihood of getting sleep apnea. And we don't want sleep apnea, as made probably very apparent by the last few slides. Also, another thing that we can control is avoidance of alcohol or maybe certain medications. Now, before you stop or change your medications, consult your doctor. But I'm pretty sure most doctors would agree that avoiding alcohol would be a good thing. And avoiding alcohol prevents you, or it's one of the risk factors that you can mitigate to prevent getting sleep apnea. And also, the certain medications sometimes are needed, but that would be a good conversation between you and your doctor. Is this medication doing enough to do its job, or maybe there's other medications that would put you at less risk? Another big one that you could do is that if you physically can, try side sleeping. Try sleeping on your left or right side instead of on your back, because the tongue is the problem in this situation. The tongue is really causing the brain injury in this situation, not just by speaking, but by falling back because it is being pulled back by gravity. And so the body, the fluids, and everything else works with gravity. And so if we change that position where the tongue, instead of going to the back of the throat with gravity, maybe it goes to the side, that keeps that airway open. And so we can also talk about nasal passage clearing. Maybe you breathe better through your nose at night, and there are certain ways that you can clear it and repair. There are surgeries out there for that, and that would be a good conversation between you and a doctor in order to prevent getting sleep apnea, or maybe address some of the other things associated with sleep apnea. Now, if you do have sleep apnea and you have tried out all those other things, there are other ways to be treated. And we have these two here called CPAP and BiPAP, which is continuous positive airway pressure and bilevel positive airway pressure. We see a CPAP in this image on the right. And what it does is it's really keeping the airway open by forcing air in. And I know that looks very uncomfortable, but this is definitely something that can be done to basically continue breathing in the middle of the night. It's just forcing air in. And the same thing with BiPAP, except instead of being one mask, it's two. It's for the nose and the mouth. There's also other less invasive methods, like mandibular advancement devices. And that's what we see in this graphic that I'm pointing out here. On the left side of that graphic, we see the sleep apnea, the tongue, and the uvula have fallen back into the throat and blocking the airway. But with the mandibular advancement device, it's really bringing that jaw. That jaw is being pushed up, thus pulling the tongue with it, thus making the airway clear and patent. But if all of that does not work, there are in fact surgical corrections to this as well. And I'm probably going to butcher this, but I'm going to attempt it anyways. We have what's called maxillomandibular advancement. It's kind of like taking the mandible advancement devices of the jaw and we're, surgically correcting them. So it's bringing that jaw to be forward. That way it pulls the tongue with it, and that's a lot of restructuring. Um, you would imagine that would be an extreme case only, but the principle is the same, except instead of it's surgery. And then we have another surgery that I found in this source down below. It's called a uvulopalatopharyngoplasty. Try saying that 3 times over very fast. But a uvulopalatopharyngoplasty is another way to open up those airways. So that way, if the tongue does get pulled back, it does not fully occlude your breathing. And so what that really leads me to believe it's just opening up the passages by bringing the jaw forward or by opening the opening. And so those are the ways that I could find that are used to be treating or mitigate sleep apnea. Take these into account, talk to your doctor about it. This is why we need to know this, especially as case managers. We need to understand these things. And so what does this leave me as the brain injury case manager to conclude? Well, obviously, sleep quality and quantity are important, not just to the rest of our body, but also the brain. That's something that we should have a conversation more about is, hey, how do you sleep? Hypoxia can come at night when you are sleeping. All right. Hypoxia is really bad for the brain. And so it can come in the middle of the night when no one else is either awake or watching. There are some serious implications that connect the brain and sleep, especially to sleep apnea and brain injury. We know that sleep apnea can cause a brain injury, but we also know that it can be an attributing factor or increases the likelihood of a brain injury. And also, we can prevent and mitigate certain things, and we can help address those risk factors. Let's think about it. Even combat medics have to carry what's called nasal pharyngeal airways, which is a tube that goes into your nose and prevents, goes in the back of the tongue and prevents the tongue from being falling back. They also carry LMAs and King LTs to do the exact same purpose as a lot of those interventions. Why? Because if someone's unconscious, they're on their back, that tongue um, can fall into the back and occlude their airway, thus creating a state of hypoxia. And that's a very bad thing. And so that's why I really emphasize prevention and mitigation because, doctor will probably tell you the same thing, but talk to your doctor about this. Let's prevent this from happening because I want to prevent brain injuries and work with those who do have them. So with that being said, I believe that will conclude it. Here are my references. They're very good resources. It's a lot of information. I know we were asked that 15-minute mark, but there's a lot of pertinent information here that is really applicable, not just to me as a case manager, but also to those who I would work with, those who I would serve, because brain injury and sleep apnea kind of go hand in hand, especially when we talk about daytime sleepiness and workplace accidents, and we talk about that hypoxia, that hypooxygenation of the body, where we see this as quite a conundrum, but it is easily treatable and easily fixable. But with that being said, I'm going to leave you to these resources. Feel free to ask questions in the comment section down below. We'd love to hear your feedback. Also, if you appreciate what we do, feel free to like this video, give it a thumbs up, and also feel free to subscribe to the channel. We put out this information and content at least weekly, and we do appreciate your feedback, and we hope to see you in the next time. But until then, I hope you all have a wonderful day, and don't forget, protect those brains.